So today we have three great presentations. The first one will be with Dr. Jerry Cox and Dr. Stephen Pennington. Then we will have Melanie Sanford from Reno, and then we'll have Herman Carvajal from Miami. So we will go ahead and jump right in. Jerry and Stephen, if you're ready, I will hand it over to you guys.
Great. Yep. Thanks, Nita. And good afternoon, everybody. I want to start by saying thank you for your interest in helping make healthcare quality higher for veterans and safer for veterans, and your interest in today's topic, which of course is about reducing and preventing falls. Happens to be, as you might see in my background here, that this coincides happily with National Falls Prevention Awareness Week, which is sponsored each year by the National Council on Aging. So that's a great thing. I also want to start by saying to all of the people in VHA that are participating in this, I want to thank you for your continued dedication to the VA's mission of taking care of veterans. I know the last several months have been a very tumultuous time filled with uncertainty and anxiety and rapid change. And I know from talking to a lot of my former teammates at central office and in the field that it's just been a really difficult time to focus on that mission and to keep that in mind when people are sometimes worried about just having a job when they come to work the next morning. So I am personally grateful to all of you for hanging in there during this very time of rapid change, and to reassure you that I think public service is still an honorable profession, and all of you have can rightly be proud of being a member of that profession. So thank you for your commitment to taking care of America's veterans, including myself. So now let's turn to the subject of today's webinar, which again is about reducing falls among veterans and how technology can assist in that effort. So I'm pleased to be joined by Dr. Stephen Pennington, who is the Deputy Chief Nursing Officer in VISN 21. So Stephen, welcome. Speaking of technology, you may know I was a Navy guy for a lot of years before I came to VA in 2014. I heard recently that in Sweden and in Norway, the militaries have decided to replace the hull numbers on the sides of their ships with barcodes. The reason is so that when the ships return to port, then they can Scandinavian.
Oh, that's
all right.
Hilarious. I love it.
Yeah, you
Thank
guys,
you very much, Jared. That's
anybody,
awesome.
anybody who has heard me speak before know there's going to be at least one horrible pun or one really bad dad joke involved in the presentation. So that was a little bit of entertainment. But now to get serious, let's turn again to today's topic. And Steve, let me start by asking you to tell everybody a little bit about your professional background and about your roles and responsibilities there in VISN 21.
Absolutely. Thank you. And thank you for your service. And then I will tell you that you had me pulled into that. I was like, why are they putting barcodes on the side of the ship? That doesn't work well. But I do appreciate you being here, allowing me to come on and talk, and to not only be celebrating Falls Prevention Awareness Week, but then also we had the first day of fall on Monday. So it seems like everything is falling into the line.
There you go.
There. So a little bit about me. So again, my name is Stephen Pennington. I am the VISN 21 Deputy Chief Nursing Officer. My history is, of course, I'm a registered nurse by trade. I have worked in many different fields of nursing. My specialty has been critical care, ICU level, and I worked in the private sector and in the VA sector, and have held every single position that you can be in nursing in the VA, from staff nurse all the way up to where I am here now. I'd like to talk to you a little bit about what VISN 21 is. I believe most people know about our VISNs, but those are the Veteran Integrated Service Networks, or regions, as we like to call them. And VISN 21 is great because it is Nevada, Northern California, Pacific Islands, including Hawaii. There, we have 7 different hospitals, 67 sites of care. We cover 294,000 square miles, and then we take care of 475,000 veterans. So it is a very great place to work here. And in the chief nursing office field here, we oversee people who manage programs at the VISN level, including care coordination. So we look at interfacility transfers, bed flow, utilization management. We look at sterile processing. We also have a key view and review of caregiver support program clinical contact center, and then also patient experience. But I think one of the best things that I love about my job is that I get to be a consultant for nursing and patient care practices that happen at all the different sites within our business. I love being a resource for our nurse executives and deputy nurse executives at the field.
That's terrific. Well, thank you also for your dedication to taking care of veterans. And I know you have a big job, and it's great that you could be here today. Stephen, what quality and patient safety issues are you focusing on in Vision 21 right now?
I think it is a really good question, because I think a lot of what we can do and we focus on at the VISN really has nursing tied into it. We have what's called nursing sensitive indicators that not only my VISN, but a lot of VISNs focus on. And nurse sensitive indicators are these sets of principles and skills that are used to quantify level of nursing quality that is delivered at facilities and help improve patient outcomes. So for instance, CLABSIs, central line bloodstream infections; CODIs, urinary tract infections; C. diff rates, the falls, ventilators. So we have found, not only in evidence-based literature across the nation, that nurses have a direct impact in helping to prevent these across all facilities, VA and in the private sector there.
You bet.
So I will tell you that we also love the focus on high reliability organization and how we can not only engage our staff and promote the staff direction at the lowest level. So, and then ultimately we look at increasing access, decreasing hospital readmissions, and improving length of stay.
Well, that's terrific. I think you all are aware that when I was still at the VACO, Office of Quality and Patient Safety, until the end of last December, that improving safety and working towards high reliability were very big initiatives that my office led and that I personally was committed to and remain committed to. So I'm happy to hear that that is all alive and well, especially in Vision 21. So we're talking today about patient falls. Stephen, what is it, based on your experience as a nurse and as a nurse executive, why is it important that we focus on that as a goal?
You know, falls are preventable. All falls are preventable, and it's something that all facilities struggle with, not only in the VA sector, but the private sector here. And then when patients fall, it really has a substantial effect, not only on the patient, but then also on the organization. So, a recent study has shown that almost 1 million patients fall during a hospitalization each year. 25% of those result in an injury, and then 10% of those result in a serious injury. So if you really look, I like to tie things into geography. So if you really look at that, that's like saying the population of Albany, New York has a serious injury every single year related to falls.
Oh.
And that data shows that falls increase costs. You have a longer length of stay, and then it's the increased cost of treatment. So around $35,000 per fall seems like it could be $3.5 million a year that is preventable. But then also from a nursing standpoint, it's that intangible cost that we see as nurses at the bedside when patients fall, including the quality of life change for patients, including hesitation to act. Someone was very engaging and now they're real hesitant to do things. And then also seeing the effect on patient morale due to a fear of falling.
Yeah, they're costly. Falls are costly in terms of not only physical injury, but also, as you said, the effect psychologically on patients, the effect on the staff that are there to try to protect our patients and keep them from getting injured while under our care. And then, of course, the financial costs. So thanks for highlighting those. I think we only have a minute or so left, but are there any best practices that you found to be successful in helping to avoid falls among veterans? I know we're going to hear from a couple of our facilities here shortly about their initiatives, but what about yours?
Yes, absolutely. I think one of the best things is just a constant reminders to patients. I've seen call, don't fall ceiling tiles above patients' beds to say, hey, as a reminder, call us before you try to get up so you don't fall. And then I'm also seeing a really interesting introduction of newer technology into fall prevention, including simulation and almost like escape room setup, not only for patients to view with patient falls with the virtual technology, but then also to train staff in an escape room type setting to kind of help pinpoint up here are potential failure points that we can identify to help decrease falls.
Terrific. Well, I think we're out of time. Thank you, Stephen, for the conversation. It's great chatting with you. And Anita, we'll toss it back to you.
Thank you.
Yes, thank you guys so much. That was great. So we're going to jump into, I'd like to introduce Catherine Verkstes from Get Well. She is our Chief Clinical Officer. She's going to take a second here to go over this slide with y'all, and then we will jump into Reno's presentation. So Catherine, whenever you're ready.
Thanks, Nina. Hi, everyone. Can you hear me okay?
Yes.
Good. Well, I am thrilled to be here to share with you just some quick news. We looked across some SHEP and SAIL and IPEC scores from 2024 Q3 to 2025 Q2. And we looked at Get Well versus non-Get Well VA medical centers. And we found some really interesting data that I'm very happy to share with you here. And you can see on the upper left corner, sort of the high level findings around falls, readmissions, and SHEP domains. But I would also point you toward the column toward the right called relative improvement. So we found that for compared with non-Get Well VA medical centers, the Get Well facilities had almost a 20% lower rate of injury of falls with injury, and overall 16% lower rate of falls, a lower readmission rate, better care transitions, better rating of their hospitals. So it was just a really kind of a large scale study across a period of time that showed us some really exciting data. So I just wanted to share that with you all.
Awesome. Thank you so much, Catherine.
Mhm.
I appreciate you walking us through this. And Melanie, whenever you're ready, we're going to jump into your presentation.
Hello, everyone. My name is Melanie Sanford. I work at the Reno VA Hospital, and I am a registered nurse on the acute care side on Med-Surg unit. So at the Reno, Nevada VA Hospital Vision 21, it has 124 beds. It provides general medicine and surgical teaching to the veterans that follows a full range of health services for these veterans. This VA Medical Center was already a high performer in veteran experience and clinical outcomes prior to Get Well implementation. The Get Well Go Live began December 7th, 2022, fiscal year 23, quarter one. So what are we doing differently at this Reno, Nevada VA hospital to prevent falls? We are having the nurses assess the veterans for fall prevention. So each day, the nurses will perform a Morse fall scale upon admission with any change of a condition upon transferring to either higher level care, after a fall, and when they are discharged. And here's a diagram of the Morse fall scale. 45 and greater is rated as 45, is rated as a high fall risk. We are also using the Get Well technology to reduce falls. So we are using this in Vision 21 at the Reno VA. And we decided to use this because this is a clinical area in need of attention because our falls rate were super high. The solution, the teams at the VA, we use this Get Well technology using clinical prompts, fall education, and fall pathways to promote fall prevention awareness. And we had patient engagement to help decrease in hospital falls. This is what is on the patient's TV when they are arrived to the unit. They have, we want you to keep you safe. Falls can happen and they are serious. They can click on this to do tell me more, or they can also remind me later to review the education later on. And upon admission, they also have mandatory Get Well fall prevention education. So they are required to see that before they can watch TV, which is a great benefit for the veterans. We are also providing fall stand down education that we discuss in the nursing huddle. We started it on the medical surgical unit, but now we are scattering it out throughout the whole hospital, ICU, CLC, and the emergency department as well. We discuss fall tips, mock fall scenarios, true or false questions, and discuss ways to reduce falls by encouraging staff to engage and either be a patient or also answer the questions. We're also educating on messaging on the Get Well network for the patients, to the staff and for the patients. On the medical surgical unit is when we implemented the no pass zone. It is an approach to respond quickly to veterans call lights, thereby reducing inpatient falls. All employees who step onto an inpatient ward who see a call light will address a call light. So non-clinical staff are not required to help the veteran unless it is an easy task, maybe pulling up their blankets or handing them their personal items. But if the staff are unable to assist the veteran, they will inform the nursing staff. They will let the nursing staff know at the nurse's station, or they can also call their phone number, where their phone numbers will be listed on the whiteboard. So after the Get Well network has implemented, the initial results trend showed a 41 decrease in the overall fall rate and a 22% decrease in falls with injury. And here are the graphs that correlate those. So the MedSurg unit began the no pass zone. It was trialing from September 2021 to September 2023. In 2021 to 2022, there were a total of 52 falls, 17 with injury, and 2 major falls. And September 2022 to 2023, there were a total falls of 36 and 11 with injury, with 1 major injury. And currently, the MedSurg unit falls rate for 2024 and 2025. In 2024, there were a total of 26 falls, no major injuries. And from January to the beginning of September, there were a total of 11 falls with 1 major injury. We are continuing to track and reassess progress using the Get Well network. After the initial success, the Get Well network noticed there was a trend upward of the fall rates. So we recognized that staff needed more education. So we've had some training sessions were provided on each units around the whole hospital to ensure staff knowledge and the content and importance of encouraging veteran engagement within the education. We renewed the engagement that resulted in amazing success. There was a decrease of 93% in our overall fall rate from fiscal year 2023 through fiscal year 2025 quarter 2. And then so far in this year, fiscal year 2025, quarter 1 and 2, we've had no falls with injury. So here's that no pass zone. If you see a call light, we encourage you to respond if you're able to. If not, then we'll let nursing take care of the call light and assist the veterans. Other changes, there's a nurse-driven protocol for fall prevention techniques. So we have post-fall huddle with all staff. We review falls throughout the whole staffing. We celebrate success with staff. And then we celebrate Fall Awareness Month and educating veterans and staff, especially during this week as well, since it's the No Falls Week, or I'm sorry, the National Fall Prevention Week. So for summary, the no pass zone has been proven to reduce inpatient falls within the medical surgical unit. There is messaging with Get Now What work that reinforce veterans to communicate with staff to assist in decreasing falls, and staff-driven changes encourage teamwork. So this is a sign, please call, don't fall, and then your safety is important to us. If you need to get up, use the call button for assistance. And then another thing we have is when you see something, say something, do something for our fall prevention as well. Do you have any questions?
So we're fielding those questions through the chat. Thank you so much, Melanie. Really appreciate your presentation. Those outcomes are great. And just in the interest of time, Herman, if you are ready, we will go ahead and jump into Miami's presentation.
Hi, good afternoon. Hey, Melanie, amazing job in your facility decreasing falls. The fall prevention initiatives at Miami VA Medical Center. We improving falls rate at Miami VA. We had an increase fiscal year 2024 in the second quarter, and it was high as 2.63%. We needed something to bring this rate down. So at the beginning of May 2024, the Miami VA Fall Prevention Committee approached Jaime Brito in Getwell to brainstorm ideas on how to Getwell network system could help us to reduce fall rate for acute care units and see how we will improve. So have an additional layer of safety and prevention for falls. So the solution, after a few discussions, we decided to focus on awareness and education about fall, and we quickly implemented the following items. One was to increase the daily frequency of the call, don't fall prompt and linked with a fall prevention video. We added a fall tip sheet with valuable fall prevention information, the creation of a post-fall education video bundle, and the creation of call, don't fall, and also increase awareness in the Gateway network. So the solution number one, you can see in the call, don't fall. We increased the frequency of the call, don't fall prompt from twice a day to 8 times a day. And now it has the video preventing falls in the hospital linked to it so veterans can start the video from the prompt upon admission. The yellow triangle matches the triangle that we have on the ceiling tiles in every room. Our second solution was we added a fall tips information sheet that you can see, and it's triggered at 10 a.m. And that's the time that we decided, since the nurses are at the bedside passing medication, doing treatment. So if they have any questions, they will talk to the bedside nurse. Once a veteran acknowledges or interacts with it, it will not be prompt anymore. The third solution was create a post-fall education bundle with 8 videos that can be assigned to the veterans from the TV or the management console at any time. And this item generated some resistance among staff because it was viewed by some as a punishment because of the veteran falling. But many times when I did the service recovery with the veterans, they understood that they were not aware and it was necessary to prevent falls while they're in the hospital. The fourth solution was the call don't fall screensaver, went live in May 2024 and has been part of the screensaver rotation since then. Solution number 5. Our public has its own tile and also has a prompt asking veterans a simple question. If they answer yes, an alert email notification to the unit staff is sent and the veteran is directed to watch one of the videos. You can see it on the screen. Okay. So the fall prevention initiative, we have the outcomes that you can see on the 2023 on the fourth quarter. Our fall rate was 2.39. For quarter 1 in 2024, we had 2.38, and it went up on 2024 in quarter 2 with 2.63. After the initiatives, as you can see in the fiscal year 2024 in quarter 3, an acute care fall rate with initiative was 2.16. From fiscal year 2024 quarter 2, decrease was 18.25. which was a great improvement. Then from fiscal year 24, quarter four, acute care fall rate with initiative was 1.44. From quarter 2022, it was decreased to 45.5. And you can see the decrease on the following on quarter one and quarter two for fiscal year 25 and fiscal year 24. Next. So the next steps, it was use of Gateway Network Round Plus for possibly rounding. In June 2025, we started a two-question vision and mobility survey as an additional layer of security to identify any needs for the veterans. Veterans that have vision and mobility limitations, we have an amazing service recovery that email responses to the unit manager and the staff. So we run it on patients, awake, alert, and oriented with fractured left leg, and the assistance provided to the patient when needed. Patient verbalized satisfaction with that and no care concerns. Patient encouraged to use cold bell and ensure cold bell it is working condition within reach, bed in low position with alarms on, and will continue running and maintaining the safety. On the second example, we rather than a patient, awake, alert, and oriented, and explain about the plan of care, verbalize, understanding, encourage using cold bell for assistance, full bundle initiated, bed in low position with alarms on, all positions within reach, staff advised to station near to the patient room, and frequent rounding. Thank you.
Awesome. Thank you so much, Herman. That was a great presentation, and glad to see that you guys have reduced falls with the help of Get Well. That's great news. I see there are some questions in the chat, and we do have about 3 minutes left before the webinar is over. So Carl, do you want to jump on and field some of those questions for us?
Sure, yeah. So I see Morel Antonio, I see that you have your hand raised. Did you have a question that you wanted to ask the team?
It should be in the chat. I don't think we have any of the audio activated for our attendees.
Looking in the chat. Sorry, folks. I don't see it in the chat.
Just a note to everyone that is attending, if you do have follow-up questions, you're more than welcome to reach out to myself. And if you'd like to get this slide deck in follow-up to the webinar, please just fill out the short survey and include your email address, and I'll be happy to send that over to you as well. That has the contact information for our presenters.
I do see a question just entered into the chat about whether there's any voice activation option using the GetWell platform for patients who don't have full dexterity with their hands. Anybody want to handle that?
Carl, are you still on?
I am. And so I'm not seeing the question in the chat, so I apologize. And I will screen through this and I will get back with you the answer to that question. There is going to be some voice activation that is going to be available in the near future, but I don't want to overpromise because, you know, with the government, a lot of times what can be is not necessarily authorized by the government. So I want to make sure I get the right answer to you, and I will follow up post-webinar with that right answer.
Awesome. Sounds good. Thank you, Carl. And it looks like we do only have about 30 seconds left here. So we will field through all of these questions and get back to everyone who has entered a question. We can see who entered those questions, so we'll be able to reach out to you via email. But I just want to say thank you again to all of our presenters, to everyone who has attended today. We appreciate your time. And again, please complete the short survey following this webinar, and hopefully we'll see you next quarter for our next community of practice. Thanks, everyone.